I'm Tyler. I'm 36 years old. I suffer with mental illness.
I'm Dale Paris.
And I'm Patty Paris. We were married in '73. Tyler was always a bundle of energy and a very, very, very happy child.
So he was on the soccer team, and he got a temper problem and ended up destroying some equipment in the locker room or something like that, and had to write a letter of apology and got kicked off the team, and totally out of characteristic for him. The frustration he was experiencing somehow in his life, and that was about the same time we were starting to get calls from the school about his schoolwork, and we started taking him to counseling in Bellevue. We did get him graduated.
In Spokane, there's a place called Division, and we had, it was next to Kmart. This was in 2001, I believe. There was this not so smart guy there, and he had his little toy trailer that he was hauling around, and I was giving him shit for it. I created a scene. Somebody called the cops. I sat down and cried and told them, hey, I don't normally do this. You know, I'm not this typical drug addict. And I was literally in tears. And he took me home. I ended up not sleeping, staying up all night, and that happened for 3 nights. Just couldn't shut my brain off.
We started getting calls toward the end of October from his roommate saying, Tyler's not, something's up with Tyler. He's not sleeping. He's just like revved up all the time.
So we agreed with his roommate, who, I mean, had known him his whole life, that he needed to come home.
We got a call from her sister, from Patty's sister, one night about midnight, and saying something's wrong with Tyler. He hasn't slept in weeks. We're putting him on a plane. When he got off, he had a full beard. He lost 20 pounds at least, 25 pounds, very gaunt. And so we actually took him to the hospital. At the end of the week, we met with a psychiatrist, and she said, it's likely paranoid schizophrenia.
Which is a really tough pill to swallow. We actually have close friends who've known Tyler his whole life and known us say, are you afraid of him? Which, like, that's the public perception of schizophrenia, is that you need to be afraid of that person.
And we explained it to him, and he said, you mean I'm going to be like this my whole stinking life?
I can't remember when I went to Alaska, but the same thing happened there. I was me, but living a dream. I thought I was seeing angels. I was tripping so hard. My parents ended up taking me to Overlake Hospital, and that was the first psychiatric ward I'd ever experienced, and it was hell.
We connected with Bob Ebel up at Community Health. He's a Samaritan now, and Bob went to lunch with us, and we talked about it. We eventually landed on maybe it was a bipolar type 1. During these years, Tyler, all these years, has been very close to my mom and dad. And during the course of about 11 months, they both passed.
He did some pretty bizarre things that were alarming, and we started worrying about him. So we did get him to the hospital to be evaluated.
When he was in the hospital up at Samaritan, we had good friends, Rex and Kathy Chamberlain, who sat with us, basically. We were talking to friends all the time, looking for someone to share it with. I think it's really important to find people in your circle that you trust to share your story with, because the incidence of mental health issues is really, really high. Some say as many as 1 in 4, 1 in 5 are affected. And the more you talk about it, what we have found is the more people who are willing to talk back and say, yeah, my brother has the same, or we've experienced the same thing with my dad, or yeah, we've lived a life of this. And people need to talk about it. So I would say that find a medical professional you can trust and a circle of friends and share your story, because otherwise you're walking it alone and it is really difficult.
My name is Mark Bassett. I've been the pastor here at Our Redeemer Presbyterian Church almost 5 years. It'll be 5 years in October. I knew Tyler when he was in high school. I was pastoring in Moses Lake at the time. I was also doing other things within the community, but so I have a long history with Tyler and his parents, Dale and Patty. They have to trust people, and they trusted me, which was an honor, because Tyler wanted me to ride with him in the ambulance. He didn't want his parents to ride with him, so I rode with him all the way down in the ambulance, and we just talked and we got him settled there. And I think that that's part of what needs to happen within community. People have to let others into their struggle, and then the community themselves have to be willing to walk with somebody in their struggle.
My name is Brooks Russell. I've lived here pretty much my whole life. This is my wife, Allison. She also grew up here.
I've known Tyler since he was a baby, since we were both little. We're not that many years apart.
I knew Tyler long before I knew Allison, and we were neighbors. We lived across the park from each other. We snowboarded together, grew up together.
It's like, it's family. It's that unconditional love, and no matter who you are, or what you're struggling with, or what your day looks like, or your week looks like, or your year looks like, that we love Tyler like a brother. So I think in the last couple of years, it has more of they have kind of put more of a legal spin on it, just in a way that we can help advocate for Tyler when Dale and Patty aren't here, physically on vacation or whatever that looks like.
Sure enough, they found the right medication after, I'm talking like psychiatrists. I've been to psychiatrists in Spokane. I've been to Lourdes and Tri-Cities, and that's where I woke up one night after one night of sleep, and in the morning I woke up, looked over, and she was squirting something in the needle, and that's the first injection I ever had. Liquid form has been great because it's snapped me out of what I was in and the low I was in.
Well, Tyler today is, he got on first of all, he's medication compliant, and he's on a medication that works, where they depot the medication in your muscle, and you get the injection once every 30 days, which has been a game changer for him.
When the COLA, the cost of living increase on his Social Security disability, kicked in for 2018, he no longer qualified for Medicaid or Grant Integrated Services, and so he was on his own. But then I had to take over all of his finances, medication, getting him signed up for Medicare, finding supplemental programs to cover pharmaceuticals, which is a nightmare. Pretty much taking care of his day-to-day needs. It's what Grant Integrated did for him when he qualified, but now he doesn't qualify, even though he is bringing home less money today than he did a year ago. He has less available cash because now he has to pay for his own apartment, he has to pay for his own food, but he also now has to pay for Medicare. His expendable income has decreased by about $200 to $300 a month.
I think the really difficult thing with mental mental health care specifically is that it's difficult for somebody who's suffering from a mental illness to be a good consumer because you're not thinking logically. So there's all these resources out there and all these pieces, and it's not streamlined. It's not, like Allison was saying, it's not streamlined, but they're all there. And for somebody who's suffering from mental illness, it's really tough to tie all those together without having, advocates.
Well, the biggest lesson I've learned is about me, and that is no amount of lecturing or discipline is going to improve the situation. It really requires just a lot of love.
I would say what I have learned is to let go of expectations that Tyler's life is going to look like mainstream average America, and that our life is going to look like mainstream retired average Americans. Learning to be realistic about this and having a sense of peace that it's okay. We can accept this, and we're just going to travel this road. It's going to be okay.
Tyler teaches me more about how God loves me. Dale and Patty have inspired me through their honesty of their own struggles and how to love their son through this, how to encourage independence, which Tyler wants and desires and can do, and yet at times how to step in a way that is encouraging to Tyler and doesn't make him have a sense that he is failing at some level. Half of life is showing up. Someone says, well, they're there. And Tyler had a struggle, and it was the middle of the night they got called, and they jump in their car and they go all the way over to Bellingham. And they're just praying the whole way that somehow they would connect with their son. And they do that. They've done that time and time again. It's easy for me to judge other people for things that I don't struggle with. Deep within us, we all have the basic same needs. And we need to listen, and we need to embrace and not exclude.
Tyler's had such a long road, and he still has a long road ahead of him. This is something he'll suffer for and deal with for the rest of his life, and he does, and he gets up and keeps going, and I think he's dealt with a lot of adversity. People not thinking he's normal, and that's difficult for him. So yeah,
I think Tyler's down moments and Tyler's struggles, and the way he puts himself together and still goes to church and goes to work and golfs and still has passion for music and passion for adventure and still has such a spice for life and such a spunky personality. To me, when I think about like what I struggle with or my struggles throughout the day, I feel like I've never had to pull myself up by the bootstraps like Tyler has. And he's done it countless times. That's really inspiring to me. I think what's important, what I'd really like to inspire people through the event is to make a friend, to be kind, to be patient, to be understanding, to not be afraid to have conversations and ask questions and understand what they're struggling with and where they're coming from.
At first, I was kind of surprised that I'm the forefront of what's going on. Why me? Well, I don't know the answer to that as of yet, but they have to know the truth about mental illness. Otherwise, you can't move on to something better. You can't fully grasp if you don't know the truth. I've been an inpatient in multiple facilities. I've come out of it. I wouldn't say I'm fully stable yet because I have my personal goals, and those personal goals have not been met to date. But what I can say about mental illness is that it's not curable or fixable unless you have a stable medication or multiple medications that can snap you out of it. And I know how hard it is to get on proper meds that don't have side effects. Now, what I would like to see and would like to people know about mental illness is that you may not understand it to the fullest, but why shun people for it? In order to break down the social stigmatism of that, we have to do something to let people know, hey, everybody has some kind of issue to some degree. And we just have to move on.